recording at this point. We also want to briefly mention that in this webinar, we're going to be utilizing the term, of course, tobacco frequently. However, when we talk about tobacco, we are referring to commercial tobacco. We recognize and understand that some American indigenous groups, Latin American indigenous groups, as well as American Indian and Alaska Native groups utilize tobacco for ceremonial, religious, and medicinal purposes. So when we talk about tobacco, we're talking about commercial tobacco. That is the product that is utilized more for recreational use. And again, we'll elaborate much more information momentarily, but I want to make sure we provide that clarification before we begin. So internally as a team, we've been discussing the idea of hosting this webinar, and really there's 3 different reasons why we decided to host this webinar. The first is to provide a refresher to all the different programs that are serving the Latino community, just in general, all the programs that have been doing the work for past several years, to remind them of who we are and the services that we do. Again, it's very easy to forget with time and with everything that we're juggling. We also recognize that there has been recently new programs funded by CTCP. So we want to give them an opportunity to get to know us and to know the different services that we provide. And also within existing programs, we also understand there's been changes in program staffing, et cetera. So really as an opportunity to reintroduce ourselves and to just provide a refresher for those that have been doing this work for many years now. So the Latino Coordinating Center for Tobacco-Free California, or LCC, we are a program of the California Health Collaborative in partnership with USC, and we are funded by CTCP to serve as the coordinating center for the Latino community. We've actually had this role since 2018 when we were funded to serve as the coordinating center for the Latino community. And in fact, it says 5, but there's actually a total of 6 different coordinating centers are currently funded to work with what we call priority populations. So I want to briefly highlight and shout out Amplify, who serves as the coordinating center for the African American community, Spark, the coordinating center for the Asian American and Pacific Islanders, We Breathe, who serves as the coordinator for the LGBTQ community, TCC, or Tribal Community Coordinating Centers, who serves, of course, as the coordinating center for the tribal community, and RISE, the coordinating center for the rural communities in California. We also recognize that there's a lot of intersectionalities within the different party populations that we serve. And we encourage reaching out not only to us, the Latino Coordinating Center, but all as well as the other coordinating centers. For example, we know that there's Latinos that, of course, identify as Latinos, but might also identify as part of the LGBTQ community or who live in rural communities. And so again, there's an opportunity for collaboration there. So we really want to highlight the coordinating centers and encourage everybody to collaborate and really recognize the intersectionality that exists within the communities that we serve. So we've been in existence since 2018, and we were originally funded. We were funded to serve primarily 8 regional projects that were funded to serve the Latino community. And so you can kind of see them on your screen. And so the approach was really more regional, and we had a huge amount of success working with these programs. They did a tremendous amount of work in the region that they serve. And in addition to these 8 regional projects, we were really, I'm very proud to say that we had an opportunity to at least partner and create partnerships with, I would say, the majority of CTCP funded programs, both regional projects, competitive grantees, local aid agencies, and statewide TA providers. With this new contract, we were refunded to serve for an additional 3 years. With this new contract, really the approach is a little more statewide. And in fact, we're working with any program that is working with the Latino community. So although our approach has slightly changed, our mission remains the same, and that is to improve the overall health of Latinos in California by reducing tobacco-related disparities through the implementation and adoption of policy and systematic changes that are most conducive to addressing the disparities through statewide collaboration and community empowerment. Really, as our name says it, the Latino Coordinating Center, and as you kind of see in our logo, we really want to establish this collaboration and communication within different programs to share best practices, challenges, and together as a state move forward to addressing the disparities within the Latino community. We also aim to make it much more easier to facilitate the access and the utilization of resources, as well as the communication collaboration among all programs serving Latino communities. So again, whether you're a local aid agency a local community focused on the Latino community, a statewide TA provider, or a competitive grantee, or also if you're a non-traditional partner who is not funded by CTCP, but you're joining us this morning, again, we aim to collaborate with you and work with you and connect you to the resources necessary. Some of those resources we might already have made. Some of those perhaps are missing and need to be made or need to be created. And that is where there's the opportunity for collaboration. So our program staff, excuse me, we are led by Evie Hernandez, who serves as the Senior Director of Program Services. Evie serves or oversees the programs within the California Health Collaborative, both in the Central Valley as well as Northern California. We're also led by Dr. Lourdes Garbanati, who, as I mentioned earlier, we are a partnership with USC. And so she serves as our principal investigator on the USC end, and she has a wealth of experience in tobacco control with the Latino community, both in California, nationally, as well as internationally. And then we have myself. I serve as the project director of the Latino Coordinating Center. I'm based near in the Fresno area, working with the programs in the Central Valley, as well as programs up in the Bay Area. And at this point, I'll turn it to my team to introduce themselves, and then we'll continue on with the information.
Good morning, everyone. My name is Luz Garcia. I'm one of the regional coordinators with the Latino Coordinating Center, and I primarily serve most of the northern region of California. But of course, as we've mentioned earlier, we are a statewide coordinating center, so happy to help anyone that wants to become involved.
Good morning, everybody. I'm Kimberly Sanchez. I'm also a regional coordinator serving the Tri-County South area, which includes San Bernardino, Riverside, and Imperial County.
Good morning, everybody. My name is Yanet Rodriguez, and I also work as a regional coordinator, and I work out of the USC office as as Rosendo mentioned. I work with Dr. Lourdes Garbanati, and together we've been doing this work for over 20 years here at USC. The regions that I serve are the Los Angeles regions, which includes Los Angeles, Pasadena, and Long Beach, the Tri-County region, which includes San Luis Obispo, Santa Barbara, and Ventura counties, as well as the South Coast region, which includes Orange County and the San Diego County. Thank you.
Thank you, everyone. I also want to highlight our advisory committee, many of which are joining us this morning. We are guided by our advisory committee to really move forward with our efforts to then better help others. And so I want to quickly mention Dr. Cindy Valencia, Dr. Eddie Jara, Gonzalo Coronado, Jose Montoya, Nora Manzanillo, Marcela Gaitan, and Monica Acevedo Guerrero, who again serves as really the group that serves as our guidance and really provides recommendation and feedback for us moving forward. So I want to acknowledge them and encourage everybody to also reach out to them, because they have a wealth of experience and knowledge, not only working with the Latino community, but really in their respective fields. So we want to thank them as well for joining us this morning. So now I'll pass it on to Yanet to talk about the end game and its impact on the Latino community.
Great, thank you so much, Rosendo. So as Rosendo mentioned, I will be talking about California's vision for a commercial tobacco endgame, which many of you have probably heard about. And as we know, it's a really important aspect of our work. But I think it's important, it's worth taking time to discuss what it is and how does this look like within the Latino community, right? So CTCP's vision is to transform California by eradicating the tobacco industry's influence and ending the harm caused by tobacco products to the health, environment, and economic well-being of California's diverse populations. So ending commercial tobacco is about ending the manipulative, racist, and deadly influence of the tobacco industry to create a healthier future for our community. And as we know, that the industry has poured tons of money to learn about the Latino community and segment our community, our population. They have gone to great efforts to target the Latino community. And as you will hear, some of my colleagues will talk about this in a little bit later in the webinar. the industry has, like I mentioned, they know how to target our community, and they know that we are not a monolith, that we are a diverse community, and they've been able to segment our community in a way to target our community. So we need to combat that, right? We also want to recognize, next slide. We also want to recognize that when we talk about tobacco, we're not referring to traditional tobacco that is used by many communities in California, and even in some indigenous communities in Latin America. It's important that when we talk about ending the tobacco epidemic, we are referring to commercial tobacco. And so when we refer to commercial tobacco, we are referring to tobacco that's intended to be sold and to be used for recreational and habitual use. So all of the recommendations that you will hear us talking about in our policy platform, as well as in this webinar, refers to commercial tobacco. As I mentioned, we recognize that many communities currently use tobacco in traditional ways. And it's important that in this work, that when we're talking to the community, and in particular, when we're talking even to the Latino community, that we do make that distinction, that we do say commercial tobacco and actually define what that is and make a distinction between commercial and traditional tobacco. Next slide. So by doing this work, we need to recognize that ending the influence of the tobacco industry and stopping the continued harm caused by the tobacco products, that's not going to happen overnight, right? And it's not going to happen with a single champion. And it's not going to happen with the adoption of one single law, right? It's going to take all of us, and it's going to take a lot of local policy work. It's going to take a lot of us coming together to do this work together, and not just us here in this room, right, in this webinar, as advocates in tobacco control, but also engaging non-traditional partners in this work. We all need to work on this collectively. So we need to build a movement, right? And we need to help our communities transition away from the notion that tobacco is normal, commercial tobacco is normal and acceptable. And we need to remind folks that it's addicting, right? And it's a lethal product, that it's actually available for sale, but we can actually do something about that. So we need to empower communities to end the tobacco epidemic by making tobacco undesirable, unacceptable, and inaccessible. And let me put this into context and provide some examples. So one of the first goals of the end game is to eliminate the tobacco industry's influence in California. And for too long, the tobacco industry has interfered with a lot of laws. As we know, they've been interfering with the recent flavor ordinance that we just passed in the state, right? But even within the Latino community, the Latino Coordinating Center has learned that the Altria, which is a company of Philip Morris, has been meeting with Latino elected officials. And one of my colleagues will be talking a little bit more about this in her portion of the webinar. But this is just one current example of how they are trying to manipulate current local efforts, right? We also need to make all of California communities tobacco free. And that means ensuring that all our communities are free from the sale of these products, free from tobacco waste, as well as free from the exposure to secondhand and third-hand smoke. So to do this, we've been, trying to pass different policies in our communities, right? But we need to also remember to create policies that don't exacerbate disparities and also don't contribute to inequalities. And lastly, one of the last goals of the endgame of the tobacco endgame campaign is that we need to end the tobacco use epidemic in California. And by that, we need to empower people that use tobacco to quit. And we need to do that by providing culturally tailored cessation services that are easy and accessible to find, right? We need to make sure that these are accessible to all different types of portions of our community. And next slide. And I want to emphasize, again, I also want to emphasize that when considering tobacco control policies, it's important to utilize equitable approaches that, as I mentioned, do not exacerbate existing disparities in the Latino community. Next slide. So we want to emphasize that, the Latino community is not a monolith, right? We're a very diverse community, and we need to do our part in trying to understand the Latino community in our local areas, because we want to engage the Latino community in all of these efforts in order for us to reach the end game. And we need to recognize that the Latino community is linguistically diverse. We're racially and ethnically diverse. We also have different immigration statuses, right? And we also have different socioeconomic, we have a lot of socioeconomic diversity in our community as well. And there's a lot of intersections within our community. As Rosendo mentioned, earlier, there's many intersectionalities in our communities, such as LGBT members of our community, also Black Latino communities members, right? So we need to recognize all of those intersectionalities and try to understand what is happening locally and engaging our Latino community in that way. Now, so I'm going to transfer it over now to Luz, who is going to continue talking about the importance of working with the Latino community. Thank you.
Good morning, everyone. So just want to, again, discuss why it's so important to why our work is so important. Why are we talking about this? Why do we exist as a coordinating center? Why do the Latino projects exist? So, of course, as Janet sort of implied, Latinos make up a really large portion of this state. Specifically, Latinos account for 40.2% of California's population, and we are projected to reach 43% by 2030. So again, this is why we really emphasize that end game strategies, if we are trying to at some point eliminate the use of tobacco or the sale of tobacco, we really have to include the Latino community both in education and in these conversations. Next slide. And then also just to highlight current tobacco use among adults 18 years or older. So right here, we really want to highlight the percent of Latino, Hispanic, or Latino adults who currently report using tobacco products, and that is 9.8%. And as you can see, this percentage itself may seem like a smaller percentage, but in terms of the population size, it translates into a large population. Next slide. And here you will see that really what that 9.8% translates to, it's 1.1 million adults. And we'll go ahead and go to the next slide. And so this estimated 1.1 million Latinos to smoke in California represent the second largest group of adult smokers in the state after non-Hispanic white. So again, if you had a chance to or have seen these graphs before, have paid attention to these charts, you might not think this is the case, but really Latinos do make up the second largest group of adult smokers in the state. Next slide. And now moving on to just highlighting a couple points of current tobacco use among high school students, specifically Hispanic Latinos. We have less than 1% who currently report using cigarettes, 4.6% who report vaping, and then 5.6% who report any tobacco use. Again, just really wanting to emphasize how these percents may seem like a small portion in terms of population size. They do translate into a larger population. Next slide. And now going on to really, how has this become an issue? Why has it become an issue? Again, I think we're all mostly familiar with the tobacco industry tactics, specifically with the Latino community. The tobacco industry has had a history of targeting Latinos. Most recently, we know that the tobacco industry created flavored products that were appealing to youth. These flavors included churros and tres leches, among other products. And then also we know that the tobacco industry has tried to buy community support through sponsorships, scholarships, and among other donations, such as the one that we highlight here, where it's the tobacco industry made a large donation to the U.S. Hispanic Chamber of Commerce. And then most recently, we also know that Altria became a sponsor of the Latino Caucus of California counties. Next slide. And then unfortunately, we also know that Latino communities are burdened with a higher density of tobacco retailers selling tobacco retailers, specifically at 103.3 per 100,000 residents compared to 78 tobacco retailers for the general population. And in the next couple of slides, my colleague Kimberly will discuss a little bit more of how Latinos are not only targeted, but affected by tobacco. Thank you.
Thank you, Luz. And just to add on to what Luz just said, as we know, many Latinos are exposed to secondhand smoke. For example, in industries such as construction, painting, and agriculture, and many others, Latinos are overrepresented in these jobs. So since many of these jobs are outdoors, that means that they're not protected under California's smoke-free workplace laws. And as a result, those who work in these fields are often exposed to secondhand smoke. And as we know, if exposed to this over a long period of time, it can result in a lot of health consequences. In addition, in multi-unit housing settings, such as apartments and condos, many Latinos are exposed to secondhand smoke through their living situation. This is especially true if their community or jurisdiction doesn't have a multi-unit housing policy in place. And unfortunately, this is the case for many Latino families, since many Latinos tend to have a larger amount of family members living under one unit. And we also know that Latinos tend to be the ones who, one of the largest groups who rent due to housing affordabilities and other factors that may affect their living situation. And in some cases, this means that not only are they getting exposed to secondhand smoke at their job because of the lack of policies, but it also means that they're coming home and continuing to get exposed where they live as well. So it's affecting them in two of the places where they spend majority of their time. In this chart that we pulled from the California's Facts and Figures, we can also see the different demographics in 2022 for those who used KK California. And for those of you who don't know, KK California is a free cessation program that offers cessation services through telephone, text, chat, and their mobile app. And here in the orange box that I think we have a little pop-up, okay. We can see how Hispanic Latinos made up 21.3% of users who utilize this program. So this shows that Hispanic and Latinos were the second largest group that made up majority of the demographic of those who used and took advantage of this free resource. And what we know from what Luz presented, 9.8% of Latino adults use tobacco in California. And so just want to emphasize that Latinos remain as the second largest ethnic group that use tobacco, second only to non-Hispanic whites. In this chart, it demonstrates the differences of those advised to quit smoking cigarettes. We can see that in comparison to the white population of 49.3%, only 44.3% of Hispanic Latinos were advised to quit. This is important because it highlights the racial disparity between the healthcare professionals and their patients, and the differences on who gets referred to these resources. And this can be due to many factors. Some may even be cultural or due to language barriers, but ultimately, the goal is to reduce these disparities to allow everyone and anyone to have the knowledge and the education and resources to make these informed decisions regarding their health. And now that we've seen these disparities that Latino and Hispanic communities endured when it came to being advised to cessation resources, we want to emphasize the importance of including these statistics in your line of work. One way that the LCC suggests to combat this disparity is through education to the Latino community, that we hope that you will help provide them and refer them to cessation resources to advise them to quit using tobacco. We also have a great resource that can serve as a guidebook to increase referrals to KK California. This is known as the Ask, Advise, Refer Guidebook, which was created by the LCC in partnership with BASTA, who was in the Bay Area. This document is designed to guide community health clinics, health centers, and any organization that serves the Latino community on how to refer Latinos to KK California. It can be thought of as a screening tool to direct Latinos to cessation efforts, but this document provides specific cultural considerations to consider when working with the Latino community. And these cultural considerations should be utilized to tailor a program's approach when working with the Latino community. And here you can scan the QR code with your phone to view it. And I can also provide a link to it in the chat box in a few seconds. So overall, we know that tobacco is a major driver of death among Latinos, with the leading causes of death being cancer, heart disease, and stroke, which have all been linked to tobacco use, which is also a contributing factor to diabetes and health complications associated with diabetes. So what does this mean for us? Essentially, this opens the door to opportunities for collaboration with non-tobacco control partners, which can really make a huge impact. This will allow us to tackle tobacco from many different angles. It's associated with many other health-related issues. So for example, we can partner up with those who work in diabetes or asthma or cancer to not only support each other in our work, but to make that relation and that connection to get closer to achieving health equity as a whole. And now I'll go ahead and pass it back to Rosendo.
Thank you, Kimberly. So in response to the different disparities that impact the Latino community, the Latino Coordinating Center developed last year a policy platform, which again, you can kind of see this or view this as a guidebook, as a blueprint that is intended for tobacco control advocates, policymakers, and really any stakeholder that is interested in working with the Latino community to address these disparities. Within the platform itself, we identify specific recommendations in addition to the background information on the Latino community, but we identify specific recommendations that we feel were most conducive for the Latino community to address these disparities. And so within the platform itself, we identified 4 different policy priorities. The first was to prevent youth initiation of tobacco use. We feel it is conducive and relevant to make sure that we prevent youth and young adults from initiating tobacco use, and that includes reducing the amount of availability and accessibility of tobacco products, as well as the appeal among young adults. So within this policy priority, we identified different policy recommendations, such as tobacco retail license, flavor restrictions, as well as limiting the sale of tobacco near schools and youth-sensitive areas. We also included a priority to prevent the exposure to secondhand smoke and aerosols. As was previously mentioned, we know that Latinos tend to be exposed not only to secondhand smoke, but also thirdhand smoke in different settings, both at home and in the workplace. And so this is of concern due to the health consequences associated with the constant exposure. Not only that, but when we think about youth and young adults, kids, children, infants, when we think about things such as thirdhand smoke, there's also a huge risk there, not only for their health, but also academic performance. So we identify specific policies that will eliminate or reduce the exposure to secondhand smoke in different settings, including multi-unit housing, outdoor venues, workplace, as well as college campuses and universities. We also made it an emphasis, a priority, to promote tobacco cessation and treatment services for the Latino community. We recognize that there's a lot of existing resources. We mentioned Kid California, which California Quits, and there's additional programs that recently have been funded by CTCP to address or to promote cessation and treatment services for the community. We also know that there's also several programs within the community itself that provide in-person cessation services. But what we really believe is that we need to make sure that these cessation services are provided in a way that's culturally and linguistically appropriate for the Latino community. And the platform identifies specific recommendations, some recommendations simply being mindful of the language of the information, the way it is portrayed, the way it is delivered, making sure that it falls in line with the cultural values of the Latino community. And just simple things such as the location or the time frame in which these classes are provided. Is it provided in a location that's accessible for the Latino community at a time that people can take time off from work, or that doesn't necessarily conflict with work? And of course, working with existing healthcare resources and services and systems to ensure there's a referral process to help people, to really guide them to Kid California and other cessation services. And we also want to make sure that we build community capacity in leadership. We really talk about in tobacco control about working ourselves out of a job. Well, at some point, many of our programs may not necessarily be here. And so what can we do to make sure that the communities that we worked with, that we leave a long-lasting impact? And I think the most importantly is, how do we make sure that they're able to mobilize on their own, not only to address tobacco, but also public health issues that impact their community? So we want to make sure that the Latino community has the skills, the information necessary to speak with elected officials, to work with the community. Within this policy priority, we identified different recommendations, such as building diverse coalitions, working with promotoras de salud or community health workers, as well as creating or recruiting youth and involving youth and young adults in the work that we do in tobacco control. And part of that as well is really making sure that they're the voice of the community, but at the same time, we're providing them with the skills necessary to become the future leaders down the road. So these policy priorities are not necessarily listed based on level of importance. These are just the way that we structure them throughout the platform. And so if you haven't had an opportunity to view our policy platform, you can access it on your mobile device by scanning the QR code that's on your screen. We'll also post a link momentarily to our website where you can find our policy platform along with additional resources as well. So we highly encourage everybody to review the document. So to transfer transition into our program services, and that really is kind of one of our goals as well, that we really want to make sure everybody's aware of exactly what do we do, why are we here, and what services we can provide you all. As we mentioned, our approach, our audience is really much more broad, and so we encourage everybody to reach out to any one of us, and we'd be glad to establish communication and build partnerships and collaborate on current or future projects. One of our program services is recruiting and engaging an advisory committee. And so many of the advisory committee members that we saw earlier, many of them are representing CTCP funded programs. And so there may be an opportunity to not only engage the advisory committee in the work that we do, but also identify and recruit additional advisory community members within these next several years. And so we may even consider or involve many of your programs, or even consider individuals here today to join the advisory committee. We also are working to coordinate with every single Latino Serving project to integrate and implement policy recommendations that were identified in our policy platform. And so if you're interested in a specific maybe training or presentation on a specific aspect of the platform for your community, feel free to reach out to any one of us. We've done that before, and we can do that as well moving forward, whether it be virtual or in person, but we can guide and say, okay, this is how we can go about this specific policy recommendation, or these are our specific recommendations that can be considered when doing the work in your specific jurisdiction. In addition to that, we're looking to revise the platform to make sure that it is comprehensive, that is up to date. So we may also include, and we welcome any recommendations, any feedback from the field on the policy platform. So as you're viewing it and you feel like there's a specific area that perhaps is missing or needs to be revised, again, feel free to reach out to any one of us, and we'd be glad to involve you with the revision of the policy platform. We're also going to be implementing a leadership development program, really falling in line with the idea of the need to mobilize and build community capacity. In this leadership development program, we're going to be recruiting individuals, both tobacco control advocates and community members, coalition members, et cetera, to join this training, to feel more comfortable working with the Latino community, knowing how to communicate with elected officials, knowing and being mindful of certain cultural considerations that will facilitate working with the community to build trust, to build rapport, to make working with them much more easier. But not only that, to make it much more meaningful and impactful for the community. So there'll be much more information to come regarding the leadership development program. Again, one of many reasons why we also encourage you to stay connected to our social media platforms to be up to date. But we would also encourage and invite everybody to apply to be a part of the program once we get that, once we identify the dates, and also help spread the word within your networks and your community to have more people be involved with the leadership development program. We will also facilitate educational meetings with elected officials. In the past, these are often referred to as local district days. Now, for those that had an opportunity to collaborate with us, whether at a local district day or during INE days earlier this year with the Latino Caucus or with other senators and representatives, we really feel it's important that we build rapport and communication with these elected officials. So we can facilitate the meetings with these officials to provide them with education, not necessarily to lobby, but only to educate them about how tobacco impacts the Latino community within their jurisdiction. We have helped in many ways with this specific activity, whether it's we actually take the lead of contacting the elected official, scheduling the meeting, whether it be virtual or in person. We can also assist with training the meeting participants so they feel comfortable with speaking with elected officials, as well as developing key messages, any other educational materials, including a leave behind packet that can also be provided to the official. So it really just depends on everybody's comfort level. In the past, we've partnered with programs that they feel comfortable leading the meeting with elected officials. So we simply join to assist, maybe with just the training or just to contribute some materials, but we didn't necessarily play a huge role. And in other situations, we were leading the meeting and we were really trying to connect the elected official with the organization. So it really depends on the organization's level of comfort and experience with the elected officials, and we can then determine our role at that point. We also are continuing to assess the gaps in educational materials and resources for the Latino community. As many of you are aware, there's a gap, and there continues to be a gap in educational materials for the Latino community, both in Spanish, but not only that, but those are culturally and linguistically appropriate. I will say that compared to about 5 years ago, there's a lot more information now due to the great work that many programs have done, the development of educational materials. However, we still feel that there's a need to create additional information, additional resources, whether they be fact sheets like the one you see on your screen, social media documents or social media materials, or even PowerPoint presentations or videos that are going to be important for the Latino community, that are going to be understood, that fall in line with the cultural values of the Latino community. For personal experience, I'm sure others might have also encountered this. When you go and speak to Spanish-speaking members of the community, you oftentimes notice that the information or the level of awareness on certain tobacco products or just tobacco in general isn't necessarily as high compared to, let's say, English-speaking groups. And again, part of that is just simply the lack of information, the lack of resources, and there's again a lot of misconceptions in the Latino community about how harmful is tobacco. They are oftentimes also maybe influenced by maybe false information that's seen on social media or that's shared within family members and friends. And so we want to make sure that we serve as a source of credible information that is really intended for the community. And so if you have identified any gaps that need to be addressed and you want to collaborate with us, or again, we welcome and we'll put the website as well momentarily in the chat box. We have some additional materials that we've developed. Feel free to utilize those to make any let us know if there's any modification necessary. And again, we'll be glad to collaborate on a fact sheet, policy brief, or any additional educational material that is going to be of benefit to the community. I just want to quickly just mention that it's not sufficient to simply put a text into Google Translate and then put that into the document, assuming that's going to be understood. The Latino community is very diverse. Again, there's some that speak English, some that speak Spanish, and even those that speak Spanish, the Spanish itself varies. The vocabulary varies depending on the region of Latin America that they're from. Even if they're, let's say, from Mexico, depending on which part of Mexico, the language may vary, right? There's certain breads, such as those that are made to make sandwiches, that in some parts are called bolillo, in other parts are called tileras. And so it's the term that is also going to vary. So we don't necessarily want to assume that simply because it's translated on Google Translate that it's sufficient. We also want to make sure that we encourage the utilization of TEC, the Tobacco Education Clearinghouse in California. But of course, if there is any additional assistance that we can provide, please feel free to reach out to any one of us, and we'll be glad to assist in these efforts. One of the newest activities that we'll be doing as well during this new contract is we're going to administer a public health pipeline. This ultimately is an internship program in which we're going to be recruiting up to about 3 students per academic year, and we're going to have them involved with the work that we're doing with addressing tobacco control disparities or tobacco-related disparities in the Latino community. And so really the goal here is to provide future leaders with hands-on experience to help them with job placement, but not only that, so that way we really create a new wave of students, of future professionals that really have a good understanding of health equity, have a good understanding of how the Latino community is targeted by the tobacco industry, and really have a good sense of cultural humility and how to work efficiently with these populations that for many years have been underserved and underrepresented. So we're going to be recruiting college students and university students from Hispanic serving institutions throughout California. And there's going to be much more information to come very soon, but we're very excited. And we will also encourage and we will really appreciate if those here present can assist us to spread the word to local universities or colleges that are Hispanic serving institutions to recruit students to join. This is a paid internship in which it will be paid throughout the program. And so it's a great opportunity, not only for financial reasons, but also just the professional experience, the academic experience that they're going to gain from this internship. And last but not least, we're also going to be administering community engagement agreement grants. And these are grants approximately about $4,950 that are going to be provided to local organizations that are interested in joining the efforts of addressing the tobacco epidemic in California. We're going to be providing CEAs to programs all throughout California, not necessarily a specific region, but really those that we feel are going to be really beneficial and vital to advancing the efforts at the local level. These might include non-traditional partners, schools, just to name a few, but really aiming to create these CEAs, roll these out. So again, we would also see how we can collaborate in extending these information or these opportunities for the general population. So before we go to the question, I see some comments as well in the chat box. I just want to encourage everybody to connect with us, whether it be via email or also our social media platforms. And so I quickly want to highlight our Instagram accounts. You can follow us at Tobacco Free Latinos, as well as our YouTube page, in which you'll find the recording to this webinar, but also to our previous webinars. You can also find us on Twitter and Facebook. And again, as we saw earlier, feel free to reach out to any one of our program staff. We welcome and we encourage collaboration, so that way we can work together with addressing the issues that impact the Latino community. And lastly, again, before turning to the questions, we also have a short little survey that we would love everybody to participate, just to give some feedback on this webinar. So again, if you have your phone out, as you've probably been scanning our other documents, feel free to scan the QR code on your screen. We'll also provide the link via the chat box or via email, so we can also obtain your feedback. And again, any feedback will be greatly appreciated for us to improve future webinars. So again, I want to thank everybody for their attention, and I'll turn it over to see if there's any questions, and I'll check with the team if there's any questions in the chat box. So 1 second. Let's see. Let me go ahead and just quickly open to see if there's any questions before we go to the chat box.
Rosendo,
Yes.
I just wanted to mention, I apologize all, I sent the wrong, it's not the wrong link, but let me go ahead and just reopen the survey. And I will do that right now. Sorry.
Thank you, Hannah. I see a quick comment from Adam about folks also speak Portuguese as well. Absolutely, really just trying to highlight the intersectionality. And one thing that we didn't mention is some of our communities also speak indigenous languages. Now, unfortunately, at this point, as the LCC, we haven't been able to develop these materials. In fact, that's one of the things that we're also thinking about for the CEAs, to see how we can also work with indigenous serving groups to have different materials for different languages that aren't commonly available, like Mixteco or other indigenous languages like Nam as well. We know in the Bay Area, there's also a good group of people who speak that language that don't necessarily speak Spanish, but speak in other indigenous languages. And I also want to highlight Brittany's comment as well. So again, I just really want to highlight Tech. So thank you, Brittany, for throwing that in there. I really encourage everybody to reach out to Tech. Really great resource. In fact, I want to emphasize that the majority of our documents, including our policy platform, were made possible with the help of Tech. So I highly encourage people to utilize that tremendous resource.
Rosendo, I did see someone in the chat. They were asking about getting a link or contact for the internship opportunities. So I just mentioned that I encourage everyone to sign up for our newsletter to be the first to hear about that and have that link ready. We will be launching that next week. So once that's launched, I mean, feel free to share it around. But again, you will hear about it through our newsletter. But of course, if you're having trouble viewing our newsletter or getting it, just reach out to us next week and we can make sure we send you that link.
Thank you,
Absolutely.
Luz. And I did want to mention that the survey should be open. So if you can all try again right now, that would be great. The link is in the chat. Please let me know if you have any issues opening it. Thank you.
Seems like it's working perfect.
Mhm.
And as Luz mentioned, and since you all are here, you will all will just kind of be the first to know that we are open recruitment for the internship starting July 5th. And so again, the idea is to start the internship in August. So again, since you all were here, you guys are first to hear, but of course, register to our newsletter to get more information, get the link to the application so you can share that as well with your networks, with those that might be interested in the internship. Again, we only have spots for about 3 students for this upcoming fall semester. So if they're unable to apply or participate, again, there'll be another opportunity as well. Excellent. Any questions from the group? All right.
Hi,
So-
can you
go
hear me?
ahead,
This
Carol.
is Carol. I don't
Yes.
have a question, but I just want to say how happy I am that we're starting out again together. We're the African American Coordinating Center. We're also going to be working more around diabetes and the other things that are impacted by tobacco with our people and the internship. So we're looking forward to working, collaborating with you, our brothers and sisters, as we move our agenda forward. So this has been a great webinar today.
Thank you, Carol.
So on that note, again, and thank you, Carol, I do want to also just encourage, of course, here with the big group, sometimes some of the information or questions, maybe some of us might have more specific questions to our local communities. And so again, we encourage everybody to connect with us afterwards. We'd be glad to have a one-on-one training meeting with our program staff and with your specific organization to see how we can identify specific collaboration opportunities. Again, whether it's related to the ones that we previously mentioned with our program services. We also have some flexibility with the amount of TA that we provide. So if you're interested in, you have something in mind for collaboration, again, feel free to reach out. We can kind of explore those options. What we really want to make sure that we do within these next 3 years is really make sure that we are able to assist in, again, creating that relationship with the Latino community, or really finding the best strategies to work with them. Again, just to emphasize, if we really want to reach the end game, as we're all aiming to do, we need to consider Latino community. We need to consider, quite frankly, every party population. Again, Carol with Amplify, with the African American Communities Coordinating Center. I mean, we really need to really work with all the different party populations because it's very important, especially because these are the communities that often are experiencing most of these disparities. So in order for us to address those disparities, we need to make sure that we bring them and really address these health inequities to help us advance moving forward. So I see a question, can you send the link to where we can find cultural, linguistic, and tailored materials? So there's two things I want to quickly mention on that. Number one, and perhaps maybe Brittany, you can also add on this. So Tech has a whole catalog specifically for in Spanish, specifically Latino community. So I want to emphasize and give a shout out to Tech for their page and for the information that they have. If anybody's interested in our specific materials that we've developed, I want to say this was posted earlier in the chat box. Let me double check. Yeah, so if you go up a little bit on the chat box, there's a link to our website. So on our website, there'll be a section for resources, and there you'll find all the different information, the different resources that we've developed for the Latino community. I will also mention that as many of the materials, as well as created by others, have been field tested in different parts of the state. Again, we're all kind of spread out throughout California to really get a good understanding, a really good, and to involve people from different parts of California to make sure the materials are culturally and linguistically appropriate. So the information is available on our website. Thank you, Luz, for putting in the chat box the link. I see another question. How closely do you work? Thank you, Jessica, for your question. How closely do you work with other LGBTQ community-based organizations? I noticed that we had We Breathe on slide, which believes it is so. So We Breathe is kind of our counterpart for the LGBTQ community, working serving as a coordinating center. Quite frankly, that is one area that we are aiming to expand a little more and really create those partnerships. I see you mentioned also Out Against Big Tobacco and the LA County Coalition, and I'll allow also Yannette to speak on that momentarily, but really are aiming to establish more of these relationships to address these intersectionalities. And so in the past, we've worked mostly with We Breathe, but we're also aiming to work with programs more at the local level. And I'll pass it to Yannette.
Hi, Jessica. It's nice to meet you. I wanted to mention that I actually a long time ago did attend one meeting, but I haven't been linked up to additional information. But as the representative that represents the LA region, I would be happy to connect with you and attend some of your meetings. So I will go ahead and put my email address, and if you could please, we could connect, and I'd be happy to join your coalition meetings as well.
And also see, Rebecca, your comment in the chat box. We would also love to collaborate. So let's connect, Rebecca, so we can see about scheduling a virtual training for the local for Latino community for the community in Berkeley. All right. Any last questions before we conclude today's webinar? Excellent. All right. So again, it was a pleasure having you all join us today to learn more about our program, our program staff, who's involved. So again, we encourage everybody to reach out to any one of us to collaborate with us so we can continue to address these efforts within the Latino community. As a last reminder, please make sure you complete the survey in the chat box, as well as provided earlier in the QR code. If you have any questions or any ideas for collaboration, feel free to reach out. Until then, have a great rest of your day, and we'll talk to you all soon. Thank you, everyone.